starts the video?
It started, yeah.
It started? Okay.
Yeah.
Let's do it.
Let's get started. All right. Well, thank you very much for everyone who came out today. I would like to introduce this event. So we decided to start a new track at the MIT Club of Northern California, Visual Health Track. This is the second event of that series. Well, the reason we wanted to start this track is when we looked at the number of virtual care interactions, they actually multiplied by 38x since COVID, and it looks like it's here to stay. So we do already have a very active biotech track, and you might have been to one of their events. We had an event 2 weeks ago on aging. But this is a distinctly different track, and we're focused on the consumerization of healthcare, more so than anything else. So today's event, Mental Health, will digital win. And we're very lucky to have a very diverse panel of speakers. We've actually, I'll let Geeta, who's going to be our moderator, take over now. And we'll try to keep it to 1 hour and then do a Q&A and another 45 minutes of networking after that. So with that, I'll hand it over to Geeta to introduce herself and our speakers.
Thank you, Sean. Good evening, everyone. Just a couple of housekeeping rules. If you have questions, please write them down in the index cards, and then raise your hand, and Jason or someone will come and get them and pass them on to you, so that way we can be a bit more efficient. And I'll try to group questions together. Okay, so just a heads up right now. So every table should have an index card and a couple of pens, so feel free to use that. Okay, all right. Thanks for modeling. Okay, so let me start off by asking a question here, so we'd like to understand who's here. So how many of you think you're totally sane? Okay, you've got one. Right, go for it. I love that confidence. Obviously everyone's here, I assume, because you have either a professional or a personal interest in mental health. So how many of you actually work in the space of mental health? Oh, quite a few. Okay, quite a few. And how many of you would like to, or are looking to work in that space? A lot more. Okay, so talk to the folks who raised their hands earlier when they're networking, so you know who to speak to. So let me ask one more quick question. How many of you are in the care delivery side of mental health versus the technology enablement side? So let's start with the care delivery. How many in care delivery? Okay. So a couple of you. And how many in the technology enablement side? A few more tech people. Okay, wonderful. All right, so panelists have an idea of who we are. Let's start off by, let's start with introductions first. Let's start with that, Justine.
Hello. Hi everyone, I'm Justine. I work at Lyra Health. We are a leading provider of workforce mental health benefits, and in my role at Lyra, I manage our suite of in-house therapy services. So we provide individual therapy for adults, soon to be teens launching next year, and also for more complex conditions like substance use disorder and suicidality and self-harm. The way that we're using technology to really leverage the services we're providing is we're combining virtual therapy with a therapist with in-between platform interactions, and we're also really we built measurement-based care into our platform. So it's a combination of a number of different aspects that has been done well in research, and we really found ways to use technology to scale that. Prior to Lyra, I was working in consulting, helping build and launch new strategic services. And earlier in my career, I worked in more traditional mental health settings, so in academic mental health, and then also in large providers of behavioral health services, and that was really focused on helping traditional mental health community-based clinics scale and build their services. So thank you so much for having me here today. It's great to be here.
Sana?
Hi everyone, good evening. Is the audio okay? Great. Yeah, it's a pleasure to be here. My name is... So pleasure to be here. Really, really important topic. So thank you, Hisham, for organizing this. My name is Afsana Akhtar. I'm an MIT graduate. I was undergrad of 98 and then of 99, course 6. I did work in tech for 6 years and then moved into digital health and never looked back. I really, really like the space. I've worked in many areas of digital health, diabetes with Livongo Health. I worked in the musculoskeletal space. I've worked in predictive analytics. And a few years ago, kind of delved into the mental health space. Most recently, I was the CEO of a company called Amelia Virtual Care. We had a cloud platform with a lot of content that could be delivered through VR, virtual reality, or mobile, and therapists could use our VR platform to assist in delivering therapy, a type of therapy known as exposure therapy, which really benefits from the use of VR because VR can very nicely simulate certain scenarios, helping a person learn emotional response by being immersed in those scenarios. So we were primarily marketing that to providers. And I've also had the opportunity to advise a number of companies in the mental health space. And I've, through those experiences, become just very passionate about mental health, even though I've kind of worked on the commercialization side in my time in digital health. Most recently, following my passion, I started a passion project called MindWise, and it's really focusing on promoting awareness and reducing stigma around mental health for teens, because as many people know, there's a real crisis, especially with teens and mental health, and we'll talk about more aspects of that later, but it's certainly elevated during COVID, but even post-COVID, even with things kind of going back to normal now, the challenges of anxiety and depression and eating disorders with teens is still, it's still at an unprecedented high level. So with that said, I'm very excited to be on the panel here today and look forward to the discussion.
Hi, I'm Prentice Tom, and I am the Chief Medical Officer with Kintsugi Health. Kintsugi Health is a company where we've developed an AI voice biomarker tool that is able to screen for depression and anxiety in about 20 to 30 seconds of any conversation. It's both content and language agnostic, and we actually listen to the spectral and prosodic elements of sound creation. It's a pretty novel concept in that we're looking at the neuromotor manifestations of pathology. And there's actually very few neuromotor manifestations that are more complex than voice creation when we think about things like how police officers determine if you're intoxicated. They have you touch your nose with your eyes closed. There's 4 muscle groups. When you actually create sound, you have all of your cognitive function. It takes approximately 100 muscle groups. You have to use your intercostals, your diaphragm, your larynx, your tongue, your throat, your cheeks, your lips, and you have to coordinate that all together to create sound. And so we've been doing that for about 4 years now. We were actually voted by Forbes magazine one of the most innovative AI companies in the US, and we're currently being deployed in a variety of clinical settings. I am a physician. I didn't go to MIT. I spent a couple of years there as a Kaiser Fellow in health policy in the 80s. I actually went to Harvard for medical school, and most of my career I was the Chief Medical Officer and Executive Vice President of a company called Vituity, previously CP America. It's one of the larger physician services companies in the United States. We see about just under 10 million patients a year, have 6,000 to 7,000 clinicians. And so it's a real pleasure to be here.
Thank you, Prentice. So we have an amazing panel out here. I'll say a few words about myself. I'm a techie from MIT who went to the dark side and went to Stanford Business School many years in my career, later in my career. But I specialize in regulatory and compliance strategy and the global issues in the medtech space, primarily digital health. So it's such a joy to be able to talk about this space. So I'm going to start off by asking the panel about what do you think is the state of the mental health situation in the U.S. in particular, but globally too. And Sana, you already started to wax eloquent, so I'll start with you. Go on, continue the discussion and tell us more about what you see in terms of the need.
Yeah, I mean, it's a very big question and a very big answer, but I'll try to just point out a few things. Certainly we've seen mental health challenges were always there, but it's really just come to light more so because of COVID, which exacerbated the problem, mainly because people were isolated, and also there was just a lot of stress and anxiety around all of the challenges around COVID. People were dying, people were afraid. So these various factors just led to this explosion of anxiety and depression among many people, and teens also, adults and youth alike. And then even after COVID, many people thought, okay, things will get better as schools reopen, as people go back to work, we're all mingling. But it really hasn't. And one reason is because it's a long tail effect. But there are a few other things, and I'll speak to the youth aspect a bit more concretely. So there is a very strong correlation, and this won't be a surprise to many people, but we're all the correlation to the use of social media and screens to the mental health of our teens. And while it seems intuitively obvious, we had to wait for the data to catch up to that to convince many other people, and the data is showing that there's a strong link between the use of social media and elevated anxiety and depression among our teens. And then the second aspect is there's a lot of data that also shows that teens are not getting enough sleep. So high school students are supposed to get about 9 hours of sleep per night. And the data, there was a large study done by Challenge Success, which is a project with the Stanford School of Education, the Graduate School of Education. Instead of 9 hours on average, high school teens are getting about 6.8 hours per night. And it's because, they're overloaded. They're overloaded with work and all kinds of things. Add to that subsections of mental health. So eating disorders have doubled in prevalence also in the past 5 years, and that's not going down post-COVID. And why does that matter? Because anorexia, for example, is an eating disorder that has a 10% mortality rate. So one of the highest, it's the highest within mental health and second only to substance use. So these are very dangerous conditions. So one challenge is social media, and I think we're all probably waiting for something to really come and obliterate social media for our teens, because as parents, it's really hard to manage teens away from that. The second piece is that detection is so late and lagging in mental health, because mental health is really not integrated into primary care right now. And I think that's a big problem for both adults and children. We go to see the doctor, they check our weight, our kids get vaccinated like clockwork. We get all our screenings done, but the screening for mental health conditions is very much lacking, and mental health conditions are complex, but very treatable. So catching anxiety is very treatable and is highly prevalent, so catching that early would be great. Depression, if caught early, can be treated, so it doesn't, one of the reasons people are so worried about depression is that there's a lot of suicide tied to escalated depression. So I'll stop there, but I think those are some of the biggest challenges.
All right, that sounds good then. And now that, so Justine, maybe you want to pick it up and talk about what are the needs that you're seeing, because you serve a different demographic, right, in your company?
Absolutely. So for Lyra, since we're really working with employers, we're very focused on workforce mental health. And I think we see in some of our research that over 86% of employees are likely to have a mental health episode or challenge in a given year, but only about 30% of them are actually receiving care. So there's a really unique opportunity opportunity for the employer to be that portal where they're able to access affordable care. And I think that's where we also see that the importance of offering a full spectrum of care. So at Lyra, we're really thinking about how do we offer everything from what we call our essentials offering, which is something similar to meditation, wellness, things that people can self-serve, all the way to our high acuity offerings, which are really helping folks who really need potentially inpatient or hospitalization and helping them find the right provider. So the employer, I think, is really uniquely served because we're spending most of our time at work, the majority of our time at work, and I think there's an opportunity for employers to really be supportive to their employees to help them get better, and it also helps the employers, candidly, too, right? There's a reason why they're paying for it, because we really see an ROI in terms of presenteeism, we see ROI in terms of retention. I think the other opportunity that we're continually thinking about expanding to is our employees, our clients have families too. So what is the role that we can support our employers in providing services to the kids, to the parent, to thinking about parents, helping them be parents. So we're generally seeing that folks, because of the kind of trends that we're talking about, are coming to work extremely stressed, right? Extremely exhausted, extremely burnt out. So there is a really great opportunity for employers to play a role in helping support, and that's where we've been able to also really develop innovative services because we're working with employers. There's a different type of payer model and different restrictions in terms of reimbursements and regulations that we also would see in more traditional healthcare settings.
Great, thanks, Justine. So, teens, young people are stressed, working people are stressed. Prentice, feel up stressed.
Yeah, I completely agree with everything that's been said. I want to point out some statistics. I'm not sure if people are aware of the 2022 CDC study on our youth that showed in 2021, 60%, 57% of all teenage girls had to take at least 1 week off from school because they looked at their lives as hopeless. And I have given this, I've actually talked at the American Psychiatric Association, American Telemedicine Society, and I meet parents, and they always come to me and they say, that statistic doesn't surprise me at all. The depth and breadth of mental health conditions in our country is truly, truly enormous. The fact that there is significant neuroplasticity of brains when we're young is a significant issue also. It's sort of like post-traumatic stress disorder that we see in Vietnam veterans. When these teenagers turn 20, it's not like their mental health conditions just miraculously improve. So amongst our youth, it's a very, very significant issue. 1/3 of all youth today have anxiety disorder. It's not just an issue with our youth. The fastest growing population in the United States is the elderly. Something like 60% of all elderly have some degree of depression. They are getting older, their spouses have passed on, they're no longer working, they have chronic disease, chronic pain, and so the amount of depression in our elderly is rapidly expanding. And as Justine mentioned, in our working population, the amount of burnout is just incredible. Amongst healthcare professionals, it's approximately 50% of all healthcare professionals suffer from burnout. The way the world is operating right now, the rapidity and change in the work demands are increasing so dramatically that what was required a generation ago is very different from what's required of the workforce today. And so you see people now actually forcing their employers to give them Fridays off, work half of Wednesdays, and the need to relook at our entire work structure is incredible. The issue on the provider side is very significant. In California, until very recently, it took approximately 2.5 days to be placed in a psychiatric facility if you presented to an emergency department. There's no more underbedded issue in the entire United States than caring for our patients with significant mental illness. Approximately half the counties in the United States have no psychiatrist at all. So the issue across our populations on both the depth and size of the problem is enormous. Our ability to currently solve this in any meaningful way is woefully lacking. It's certainly not something that our primary care physicians are equipped to handle. Only approximately 4% of all primary care patients are screened for mental health conditions at all. I do want to very much agree with what Afsana said. I believe one day we're going to look at some of these social media sources as R.J. Reynolds. We're not recognizing the significant detrimental effect that social media plays in this. It's multifactorial, but social media definitely has a role. And actually, when we in our organization try to get patient populations that we can study, we go to social media, and the rate of people with significant mental health conditions is dramatically higher than areas where they don't use social media as often.
So that sounds grim, but with the entrepreneurs here, it means opportunity, right? So here's a chance to make a difference in the world. So with that, I'll go back to you, Justine, since you've already started talking about some of the solutions you offer. So let's talk about what's being done now to address it.
Yeah, I think that what's been said is absolutely accurate, but I think we all probably work in this field and work in the intersection of tech and mental health because it's so exciting, and because there is so much opportunity, and because there is so much opportunity for technology in particular to enable the work. And I say that having worked both in more traditional settings and now at Lyra, and I think what's really exciting about what we're doing at Lyra is we're really trying to take clinical models that were validated in smaller research-based settings and in smaller settings and thinking about how we scale access. So there's three components to what we've been doing. We've been, one, able to use AI to really help match people in an efficient and timely manner to a provider that best meets their needs based on maybe their preferences on in-person, video, text-based, but also if folks maybe share the identity that they desire, or if there are certain expertises they have. In the care that we provide, that we call Lyra Care, we're both really thinking about how do we take evidence-based practices, so for example, interventions like cognitive behavioral therapy. Well, traditionally that's done with, you're meeting with your therapist and there's in-between session care. We've brought all of that onto a platform. And so we're able to also track and measure what that interaction looks like in between session. And we find that it makes people are able to get better faster as a result, because they're not just having that therapy or coaching or medication intervention with their provider, they're also actively engaging in lessons, activities in between care, and that makes it much more effective and powerful as a result. And again, we're able to really capture and measure that through our platform. And the last piece that is really, I think, something we've been able to really scale through the use of technology is our use of measurement-based care. So we're constantly capturing through the PHQ, GAD, and other measures the folks' outcomes over time, and that's how we can really tell that folks are able to get better through the services that were being delivered. And it also informs our payment models for our providers, which are performance-based, which I think is a very motivating part of what drives our model. So I think it's been, for me, really exciting to work in an intersection where we are taking some aspects of what we know works, but then thinking about how do we scale access to hundreds and thousands, soon to be millions of patients through using technology to enable that growth.
Okay, and then Prentice, I'm going to ask you the same question to talk about the solutions that you're seeing now.
Yeah, no, actually, I think this is the perfect group. I think there's so much opportunity, and although the problem is enormous, I think technology has a significant opportunity to address the issues. There is significant scalability with tools like what Lyra is creating. When we create virtual care settings, we actually make clinicians much more available. And then we can also look at tools like what Kintsugi or some of these other companies are doing to identify people. And it's a voice biomarker is completely non-invasive, it's highly scalable, and it allows us to even stratify populations so that we can look at the entire spectrum of individuals, from people who have very minor conditions to people who have very serious conditions. And then you can identify what the correct resource is for those individuals. So the opportunity in terms of technology is truly great. And the work that's being done right now, both in terms of virtual care and creating platform companies and automating the marketplace and in creating new tools to identify individuals, not just voice biomarkers, they're individuals who are creating wearables so that they can follow people and know how long they spend combing their hair, how long they spend sleeping, how long they spend eating, and then they can correlate that with when they're going to develop an episode of depression or some other condition. And if we can identify these people early on, then they never get to that far right end of the spectrum where they need a higher level of service. We get to them when they might just need a counselor, a peer-to-peer support group. They might just need a vacation or a massage, and we can find these other solutions that are for individuals well before they get to a point where their disease is significantly advanced.
So both Justine and Prentice talked about at a population level or at scale level. So Sana, you want to bring us to like a more on the ground level? Like, what does it take to come up with what are some on the ground solutions that you're seeing that you think are exciting?
Yeah, I agree that there's such a big role that technology can play, because even if we solved the problem of identification and we, with the stroke of a wand could identify everybody that needed mental health support, and if all of them came forward, we simply couldn't service them. There just are not enough clinicians in the world to provide the mental health support that our global population needs, and that's where technology comes into play. But what does exist in mental health is very clear evidence of what works and what doesn't. Cognitive behavioral therapy is one of the most efficacious means of treatment for anxiety, depression, exposure therapy that we talked about. So how do we scale these evidence-based practices that we know work and work very well so that it can go to the masses? And I think at the core is moving away from this centralized, constrained supply to a more distributed manner where we're pushing the treatments and these capabilities into the hands of consumers. And we've seen this done in other areas as well. When I was at Livongo, that's in essence what the product did. It moved the knowledge and empowerment and support of diabetes into the home, into the hands of the consumer, so that they didn't have to rely solely on their provider for day-to-day and hour-to-hour diabetes care and management. Similarly, so when we go to a therapist, typically they're treating us with cognitive behavioral therapy, helping us become more aware of our triggers, our thoughts, our reactions, our behaviors. But just doing that once a week or once every other week with a therapist is maybe not ideal. What if I could do that real time? What if I could do it day to day and hour to hour? And there's promise, because there's wonderful tools like voice biomarkers, like what Kinsuki's doing. I also had the chance to wear this wearable. It's a wristband that's an emotion sensor that I wear all the time, and it's continuously tracking my emotion by using heart rate variability, electrodermal response, and my general activity movement, and it's able to actually sense variations in my emotion, and it can actually give me a little buzz or vibration telling me that I've had a little spike in my emotion. And that what that does is it points me to an app. It notifies me to go to the app immediately or within half an hour, and it walks me through a micro CBT intervention. So it's almost like a proxy therapist, hour to hour and day to day, just taking me through what was my trigger, what was my thought, what was my action, what was my feeling. And so by that, it promotes my awareness. And then with that elevated awareness, I can then better manage my emotions. So the technology is here, and there's opportunity for more that puts these evidence-based methods into the hands of consumers. And what we really need to do is see that scale out. So what I really look forward to is our healthcare ecosystem supporting the proliferation, the adoption, the introduction of these technologies, present and future, allowing mental health to be more accessible to the masses.
That's great. Yeah. So to summarize, there is large scale matching type solutions. So to summarize, they're large-scale solutions, taking through employers, taking an ecosystem of providers, an ecosystem of people in need, putting them together. There's like self-care, micro-level technologies, and then there's sort of the more systemic, supporting the clinicians and so on. Prentice, do you want to share a little bit more now from the clinician point of view? Like, what does it take to bring the clinicians into the solution space?
Yeah, I actually think that there is an increasing groundswell of movement towards addressing mental health conditions. The primary issue from the physician perspective is a lack of physician resources. And I think one of the key solutions are these other opportunities where they're creating a variety of other interventions that people are mentioning that allow us to really broaden the opportunity to intervene on individuals at varying stages of the disease. I think a lot of these new verticals that are being created in healthcare are going to provide an avenue for entry. And actually, I think the direct-to-consumer approach makes a lot of sense, because if we can catch and identify individuals early on, then that actually helps significantly. I think there needs to be social change too. I actually think that we need to go to our schools and teach our youth the appropriate use of social media, how to recognize when social media is presenting them with a very unrealistic picture of the world. We need to create solutions in terms of the social environment for our elderly and how they live, and creating group settings where there's less isolation. We need to look at our working population. And there are tools right now that do things like they look at how long it takes you to answer your emails and how long your emails are, and they can tell when you're getting burnt out. And we need to start using these tools to actually support versus identify people for, these people are getting burnt out, but to actually support our working population. So I think there's a lot of solutions out there, and that we're going to see many of them come together in a much more coordinated fashion in the next few years.
So back to the optimism, right? There's solutions out there. So let me swing back again. What are some of the challenges? So Justine, I'll start with you. The first thing that anybody asks when you try to raise money for an innovation is how you're going to make money. So what are some of the challenges around reimbursement, revenue models, and just the financial aspects of this mental health innovation?
I think that the challenge for many companies is really figuring out the payment and revenue model. And I think partly because some of the challenges we've mentioned around stigma around mental health, while direct-to-consumer is appealing, it often can be really challenging. And this is particularly true for services, or companies want to charge a premium for maybe the app that they provide, even if it's more accessible. I think a lot of folks who have mental health challenges don't necessarily recognize that they have a mental health challenge, and even if they recognize they have a mental health challenge, they might not want to pay. And so I think that continual challenge makes direct-to-consumer very difficult. When you look at more traditional payers like health plans, in particular government payers, there's just a lot of regulatory constraints. There's a lot of challenges of making sure that you're really able to use the right reimbursement codes, you're billing appropriately, you're in compliance with the different rules. And so that adds a lot of complexity and a lot of challenge. And so I think that's where, at least personally, I've observed a lot of companies increasingly gravitating towards the employer space, because within the EAP model in particular, there is more flexibility. You do need to meet certain constraints. You need to be delivering care under certain kind of components, but it's not as highly regulated, and I think there's a lot more flexibility in what is able to be covered. There's probably a higher range of payments that is being able to be delivered, so there's more flexibility in terms of the business model. That I think we see a really wide range of prices that can be charged. Really, if the employer is willing to pay it, then that price can work, right? So I think within the employer models, there's a lot more flexibility, but obviously you have to really, they also want to see results. They want to feel confident that you're going to deliver results for your workforce. And I think the last thing I'll say is that working with employers, it's also important, the services you provide are very specifically in helping their employees get better, which may not be the same as helping someone achieve their mental health goals. There's actually a bit of a tension there. So I think that tension is also something to consider in terms of, who are your payers, what are their end goals, why are they paying for your service, and then how does that impact the service or that you're providing.
Right, and then I'll just pass it on to Afsana. So Afsana, then what are the challenges that you're seeing in the innovation space? Obviously business model is one, but then technologically or other areas, why don't you talk a bit about that?
Sure. I think Justine spoke a lot about kind of, there are different segments that so if you're an entrepreneur or a CEO in the space and you're trying to figure out a viable business model and revenue model for the company, there's B2B2C through payers and employers or providers. And each of those segments, and then I'll throw in there PBMs, the pharmacy benefit managers. So healthcare is a really complex ecosystem and it's very interconnected. So I think it is important for any company to really understand where they fit in the ecosystem and where they're delivering value and what kind of value. If they're delivering value to an employer, what is that value? Same to a payer, same to a provider. And what I've learned is there are some consistent themes there, and Justine already spoke about the employer, but for the payer, depending on the population segment, because payers also, they have clients who are self-insured employers, they have Medicaid populations they're serving, they have Medicare, exchange populations, and the value they're looking for may be a little bit different in each, so I think it's very important for a company to understand that. In some scenarios, the health insurance companies are looking for very strong financial savings. They're looking to manage the cost of care of a population, and so they will look for studies where a certain solution will show financial savings within a certain period of time, oftentimes 1 year. In other cases, showing clinical improvement is the top priority, or showing customer satisfaction or engagement or retention. So all of these potential metrics can be important to varying degrees. And so I think it's very important for a company to, one, start early in understanding what are the metrics that they need to measure, where they can have the most impact, and to whom those metrics will have the most value. On the provider side, yes, providers are also very much looking to improve the quality of their care, the efficiency, the scalability of their care. They want high patient satisfaction as well. They want to avoid readmissions. There's also financial aspects. One is avoiding readmissions. The other is, though, when a provider has, and the way providers make money is mostly reimbursed still from the payer. So when a provider has to pay for a solution, where is that money going to come from? And typically, the best scenario is if they can use that solution to also increase their revenue by making it billable to the insurer. So there is this conundrum of there's new innovative tech, but maybe the existing traditional status quo billing and reimbursement mechanisms don't perfectly align to that kind of solution. And then the entrepreneur has to really figure out, well, then if this can't be reimbursed by insurance, then how does this get paid for? Does the consumer pay for it? Does the employer pay for it? Who's going to pay for it? And do the benefits justify the spend? So these are very important questions that an entrepreneur really needs to think about.
Yeah, I think you both pointed out, if you look at the status quo and you try to insert a new technology into the status quo, there are some inherent tensions that you're going to run into. The provider goals, the employer goals versus the employee goals, or the billable reimbursable time versus getting people better, or there are these tensions. So that's probably true in any innovation space. So you've pointed those out there. So Prince, I'm going to ask you a related question. Coming from the provider side of things, or just in general the treatment or therapy side of things, what do you see the healthcare industry or the healthcare system's role in trying to enable some of these solutions?
I think the healthcare system is not one entity. It's broken up, it's incredibly fragmented, and it's many, many, many entities working completely separately and not in conjunction with each other, often opposed to each other. So it's a difficult proposition. I actually think that the solution has to do with the reimbursement, and that we need to start there, because the healthcare delivery system really is reactive to the reimbursement system. And if we look at things like virtual care has the capability to do virtual care has been around for many years, but it took off only a few years ago because of the pandemic and the fact that the federal government said we're going to reimburse virtual care as we do an in-office visit. And so that created the financial mechanism for us to embrace that type of technology and that type of service, because the clinicians are out there doing what is in their best financial interest otherwise. And we'd like to believe that clinicians are doing what's in the best interest of society, but they're actually doing what's in the best interest of how they're being reimbursed. And so when we create the financial mechanism for them to be reimbursed properly, and I think we're starting to move in that direction. We're just, even in the last few years, we've recognized the impact of things like depression and anxiety on our immune system, and the fact that people who have lifelong untreated depression and anxiety have a much higher rate of cancers, of heart disease, of various other conditions, and vice versa. The cost of caring for someone who has chronic disease, if they have untreated depression, is twice as high. Those people seek medical care much more frequently. 2/3 of all emergency department recurrent users have some mental health condition. And so when we put in place value-based incentives that push for the clinician to pay attention to the mental health conditions, to do the appropriate screening and diagnosis, then I think that's really going to be the solution.
So really it takes all parts of the ecosystem, change in education, change in the economic conditions and reimbursement and clinician incentives. I do have one final question for all of you, but I won't ask it just yet. I'd like you to do a look ahead and think about what one thing that, if there's one important thing in the look ahead that you could share with the team, with the audience here, be thinking about it. But in the meanwhile, why don't we take a few questions? One last, you guys start here?
Yeah, I'll get you started.
So,
They get increasingly harder.
okay, all right. Thank you for curating them. Yeah, and if you have additional questions, somebody raised a hand there, Jason, someone answered. Okay, great, very good. Okay, so I'm just going to run through them kind of as best as I can. So knowing social media challenges, mental health, do digital solutions sadly
Perpetuate.
yeah, disconnect from phones and apps and perpetuate the problem, and keeping going on? That's the question.
I can start us off. I think what some of the evidence is showing is that the reason social media, you might have to turn off. One of the reasons, so why is social media increasing anxiety and depression? It's because social media increases the comparison factor and FOMO. And so those are the triggers for why people feel bad, and this constant comparison, it also increases, there's like more channels over which to bully people. So I think if we see those as some of the key reasons that social media is causing this problem, if we can remove those elements, and typically the digital solutions, for example, they're helping us. They're not causing us to compare ourselves to somebody or feel left out or get bullied. So because of those factors, I think these digital solutions are are designed to help us rather than do those things that hurt us.
So I'll do a quick follow-on for you, Afsana, and then Justine I'll get to in a second after that. So two related questions is, and one put it really well. It said many of the digital interventions use the same platform, such as mobile phone sources, which are the sources of anxiety and stress. So on one hand, we're blaming social media for the problem. On the other hand, we're saying the solution is social media, and technology out there. So, how do you balance the two? And then, so say a couple of words about that. And then the other question is social media crowding out the real social connection that people need? And is that the core driver of mental health? So maybe, perhaps you can speak to that second piece, but I'm going to go ahead and say a few words about, this tension between the very technology platforms that we're innovating on are what we're demonizing right now and saying.
It's a really good point, and I think it goes back to what is the purpose and what is the use case. If a tool is causing us anxiety because we're comparing ourselves to others, or all of those things I mentioned, comparison, FOMO, and bullying, or things like that, then it's harmful, or it's addictive in some way, like a video game that messes with our dopamine levels. That's different. But if it's assistive, if we're using it to learn, if we're using it to create, if we're using it to interact with our parents and our grandparents and our children and our friends, then it can be helpful. But yes, as we hear, too much of anything is bad.
So Justine, go ahead and comment on that a little more.
I think to build on that point, it's about what are we using the technology for, and I think what's been really fantastic about using technology to scale access to mental health services, we're giving access to people who wouldn't have gotten it before. So even though it's delivered via computer or mobile phone, it's more staring at the screen, it's helping people who might not normally have gotten access to mental health care get access. And I'll tell a story. We launched actually our service 5 years ago, and one of the first people who booked a service was a woman who booked at 8 p.m. on a Saturday. And it turned out she was a woman who was struggling through postpartum depression, had a newborn, and it was the only time that she was able to access care, and she couldn't go to an in-person care visit. And I think that's a good example of how, when we've been really focused on face-to-face methods of delivering care, there are limitations. If you're living in a rural populated place where you don't have access to anyone nearby, there are limitations. So with every technology has its evils, absolutely, but I think there are also enormous opportunities for the access it can enable for people who wouldn't normally have gotten the care otherwise.
And Justine, there's a follow-on for you on a comment you made about the divergence between the mental health helping employees get better versus that may not align with the employer's goals. So can you elaborate on that a bit?
Yeah, I think there's a very interesting framework I like to think about where when people seek mental health care, there's a range of seeking help for health versus self-actualization. And so I think that the employer is very interested in and is willing to pay for someone's ability to get better, right? Someone to really recover. Maybe they're not able to function, they're clinically impaired, is really what we would say from a more clinical perspective. And that's on the health end of the spectrum. A lot of people we actually find want to go to therapy for self-actualization. They want to come week after week, they want to debrief about their week, they want to feel supported, they want to feel enabled. That's not necessarily to get them better, it's more because they're discovering and they're figuring out where they are in their life journey. And I think there's nothing wrong with that therapy, but the reality is that an employer might not want to pay for that self-discovery journey. An employer is really is often focused on how do we help you get better as quickly as possible. That's not true for every employer, but that is often a tension when you think of that spectrum of health versus self-actualization, that again, depending on the payer that you are working for, what are their goals, and then how do you need to adapt your service based on the goals that the payer may have.
So, Justine, I'm hoping why don't you pass the mic to Prentice, because I'm trying to. I'm going to switch gears a little bit and talk about policy and funding for digital health and maybe some coverage, or is there money in the healthcare system to fund it? So could you talk a bit about, and then where does the role of advocacy fit in?
Yeah, currently there's not funding from the federal government or from most payer groups for digital health solutions. So I think advocacy is going to be a very important part. Right now, to the extent that digital health is creating scalability and efficiency for care providers, that creates a financial incentive for groups to start using various types of digital health. And so, advocacy is incredibly important, and all of us could support that in a variety of ways and just be advocates and make other people aware of the extent of the issues that are facing our whole society.
So the follow-on question I would ask, and it's related to another question, is do you see any public, like a focus with grant funding opportunities or through the NIH or through other agencies?
Absolutely. There's a fair number of NIH grants that are constantly being released to deal with mental health issues and to help early stage companies develop their solutions and perfect them.
Okay, and then I'll pass back to Justine here. So Justine, what do you think is where do you think workplace norms are going to go with this? Do you think there'll be mandated care for employers, or because that's been some of the questions that come around that. It's like, are we going to change our ways as a society and require that, or would it be maybe mental health education? But I want to speak about the workplace. Do you see that coming at all, or do you think it's a long way away?
Well, it's interesting because for some industries there actually is mandated care. So, for example, if you work in the oil industry, there are regulations around making sure that folks, anything really where there's safety and health at risk, there are already some mandatory care requirements that occur with employers. I think more broadly, employers are, I don't think we're seeing a trend of moving towards mandated care, but I think that employers are really interested in helping improve the general health of their workforce, which might not be care, but for example, we provide a lot of trainings for managers on how can they better support their employees. How do we really think about engaging employees into the point of being self-aware of their mental health and being aware of their wellness journey? I think so much what we've been saying is that obviously folks should be able to access services when they need it, but the big opportunity really lies in helping people just generally be aware of what their mental health status is and be able to proactively take the time to address it. And I think employers are very interested in what that looks like and how can they equip, in particular managers who are often the front line of helping employees, be equipped with those tools. So I think there's, that's really where the most opportunity is, and I think in the future there may be more movement towards asking employees to drive care, but that really also draws a line that I think a lot of employers would be hesitant to cross.
I'm going to get back to just there are a number of questions around the healthcare provider space. I'm going to use that microphone. So I'm going to consolidate a few of them around here. So the first of all was, it has to do with, what's it like from a physician standpoint to provide care through a digital means, and is that less personal to you, or do you feel it's less of a team sport, it's lonely, now it's you and the machine talking to your patient, or like how does that change your experience of caregiving?
So for behavioral health in particular, it's actually pretty attractive for clinicians. A lot of clinicians have moved to a behavioral health platform and provide a significant portion of their care virtually. Interestingly, it's actually been shown in a number of studies that patients find it less threatening to have a clinician that is interacting with them virtually than in person sometimes. And so it's actually beneficial in some ways to those patients too. We're still very early in looking at how the virtual setting impacts the interaction versus the in-person setting. And so it'll still take some time to sort of iron out which patients are best suited for which type of environment and which therapist or which intervention is necessary, because a lot of these patients, they may require a different type of counselor, a different type of cognitive behavioral therapy, and we may be able to use a variety of different clinicians also. But I don't see any significant disincentive for clinicians to use virtual care.
So you actually already answered the question that is, do you see digital mental health care replacing in-person care? And I guess what you're saying is it depends, that it needs to be tailored to the individual person out there. There's a follow-on question, but I think it's Sana, maybe I'll send it to you, which is, are automated systems sufficient for working with trauma, since you specifically spoke to that? And any thoughts about using somatic practices in a way that can be scaled?
So I'm not a clinician, but here's what I've heard from other clinicians. I think particularly with trauma, when I was at Amelia Virtual Care, virtual reality was found to be very helpful in so much as it allowed better exposure therapy. So in treating trauma, a lot of time what therapists like to do is gradually expose a person to the traumatic event. Because if they do it all of a sudden, it may be too much, and the person may reject therapy. Whereas if they can take a more controlled, gradual approach in a safe environment and help the person cope and manage their emotions as they're gradually being exposed. It may desensitize them, they may learn to manage their emotions in kind of an incremental capacity. So in that regard, a digital tool such as virtual therapy can be very supportive, but it's done under the guidance of a trained clinician, because trauma is quite serious. And for that reason, certain things that are serious enough, serious mental illness, should really be treated with a trained clinician. What was the second? Was there a second part of the question?
Yeah, I think it just had to do with, gosh, I put it
Digital
away.
means?
Is digital going to replace mental health? But I think Prentice already addressed that. And Justine, then a follow-up for you, which is, how do you measure quality of care? So, whether certain types of care is effective is a different story, and Prentice already talked about whether it's not a one-size-fits-all. So now, given that's the case, how do you measure the quality of digital mental health and in the interaction? And is there some kind of a score for your providers?
So I'll say that we have leveraged proven established methods to be able to measure. So we use clinically validated measures like the PHQ, the GAD, which have been validated through numerous research studies. And we're using that to really look at all our providers over what we call an episode of care, over a time working with a client, achieving reliable change. That is, do we see a shift in the symptoms that are self-reported by the patient in such a way that we believe is really showing meaningful improvement. And based on the evidence base, we feel confident that when we do see that shift and we do see that change, we have achieved clinical outcomes. We also measure in between platform interactions. And we have done, through our own research studies, clinical research studies we've done, we've shown that their clinical in-between platform interactions can actually have just as much impact, if not more, than the actual therapeutic relationship. And it can meaningfully impact the progress of the clinician. That being said, I think that methods we're using are powerful and validated, but I think there's a lot of exciting opportunity and for technology to help us move beyond self-reports. So I think there's always some challenges with self-report. I think that finding scalable, cost-effective ways to do so is still very much in development, and look to my fellow panelists to speak about maybe what some of those methods are. But I think what we've been able to do is, again, take things, take interventions, take methods and measures that we know are really effective overall from the clinical research that's been done, and using technology to enable that. What that can look like in the future, I think, is an exciting opportunity.
Quality is really hard to measure in medical care in general, and it's probably one of the most difficult in mental health. Even in areas where it's pretty easy to define how people are doing, say, congestive heart failure, where you can measure the ejection fraction and know exactly their ejection fraction is, it can still be difficult because everyone, their underlying morphology, their underlying pathology is significantly different. And so how they improve with a certain type of medication or a certain type of therapy varies a fair amount. That's why large-scale data analytics is going to be very useful in terms of being able to measure quality. In mental health, it's more difficult because we have tools like Justine mentioned the PHQ-9, the GAD-7. Those are very imperfect tools, but when you think about mental health, there's no area of healthcare that is more art and less science. Because it's really someone who sits here and says, well, after talking with you for a while, I've decided you're depressed. And there's enormous shades of gray. And so determining how much someone improves is a very, very inexact science. And even these surveys, they're not by any means a perfect survey in terms of assessing one's mental health. So there's a lot of work to be done. I think when we look at, again, when we can start to get these tools that are able to look at a lot of different individuals and how they're improving, and we're gonna develop much more sophisticated data analytics.
Thanks, Prentice. I have a couple of very interesting questions around the underserved and the elderly. And I'm going to ask each of you to respond to that. So here are the questions. One is, are digital tools really the right tools for the elderly? Is this population the most suitable for that? I have some thoughts on that too, but I'll let the panelists talk first. And then secondly, the access to care for the economically underserved and those who are not on the internet, or who are hourly workers, or who are underinsured. Like, what is the opportunity for these people? And why don't we just do a round robin with each of you talking about it?
I'll focus on the underserved piece, so that's where I have a little bit more context and expertise. I think so. We do work with a number of employers who employ hourly workers, some of the biggest employers in the world, and I think we do see that even though there are challenges for hourly workers to access our care, many of them do have mobile, they do have access to computers, and we are able to provide effective care for them. And I think in work that I've done more around underserved settings, it's true that folks may be less connected to technology, but we actually see that there are increasing numbers of people who still have access to mobile, maybe not a desktop, and so the more that we can deliver care through mobile, that is extremely effective. So it's not the only answer. There are obviously limitations. I think when interventions are delivered through computer, that can be more challenging, and obviously not everyone has access to wireless, but there is a lot of opportunity. And again, I go back to this idea of if we're able to really get people access who normally wouldn't, I think we're still able to make an impact, and we've certainly seen that through a lot of the larger employers that we serve who have those hourly workers who most of the time it's the first time they've ever had access to therapy in a meaningful way, and we've seen really tremendous impact through that work.
Yeah, I would add that I think there's a big opportunity for technology to improve the scale of care, bring down the cost of care, and thus make it much more accessible for people who have to pay out of pocket. Even a therapy session, private pay is over $150. Even when paid by insurance, that means somebody has to have good insurance that will cover a therapist, and then also be able to provide access to that therapist, and even then there might be a copay of $25 per session. So technology, I've heard of peer therapy that's available at $8 per month for a person. So technology can really bring down the price point, and also just the convenience factor is huge. We all know taking time out of one's day during business hours to go see a therapist or a practitioner is for many expensive, because they have to, if they're working hourly, they can't do that. But being able to do it digitally without having to drive somewhere, especially if you're in a rural setting and somebody's not nearby. So there are many advantages, and the mobile phone is widely used by most income brackets. I think with seniors too, I know for a while the industry kind of underestimated how much seniors were using mobile phones, and now I think we've all realize that seniors can really receive a lot of care that way.
I'll do a quick follow-on for you, Sana, which is, what are your thoughts on LLMs, and do you think, how close are we to a chat GPT-like therapist on the technology side of things? And actually, everyone's willing to, I'm happy for everyone's thoughts, but since you're more of the technology watcher sort of over here, tell us where you see that.
Yeah, and I welcome Prentice's thoughts on this too. I think what's been found is that LLMs can mimic the dialogue of a therapist pretty well. The tone of voice, the line of questions around something. So I've been in the presence of clinicians and where they've tested this out, and I think it has a lot of promise. But I think the industry and the folks that are testing these things out are really trying to solve many of the corner cases where it doesn't work, because what is true about LLMs is that some of the gotchas can really cause a loss in trust, and once that trust is lost, it can have very negative repercussions.
Go ahead, pass it on to Prentice. So, Prentice, more your thoughts on both the underserved, the elderly, and maybe the use of LLMs.
So, first of all, I don't think the solution lies entirely in healthcare, or maybe not even majorly in healthcare or medical care. The solutions are social. I think we need to look toward something much more broader than healthcare to create the solutions. We need to look at our schools. We need to look at how we address social media. We need to address the living situation. We need to look at what's a living wage. I think the issues that we're facing, we need to look at on a societal issue. I do have a lot of faith in LLMs and the future of technology to improve medical care. I think that we'll get to a point where we will be able to create very realistic and valuable solutions using virtual chatbots that are able to interact with patients in a very meaningful way. And so I'm a very firm believer in that future. I don't know if it's true, but I'm a firm believer.
And there are solutions out there. Prentice, you mentioned a couple, Ellipsis, for example, that do use LLM-based technology models. I wanted to switch gears a little bit before we get back to there, more questions on reimbursement and funding. So there are two questions. One is a quick policy question, maybe Prentice. Why do we separate care into medical, dental, vision, and mental health? What's the history behind that? Because you're a practitioner, and why do we do this?
I'm too young. I think that dental care was added only about 20 years or so ago, and that for some reason it's not clear to me why these things have been separate. In fact, I have hearing aids. That wasn't added till just very, very recently even. And so there's all these different benefits that have been added, and I'm actually not familiar with the history of that.
So blame our ancestors, our previous generation for putting this. Okay, so there's a set of questions I kind of wanted to save a little to the end, but they're all coming together here. And this has to do with the global perspective, and is the US experience different from the rest of the world? And there's a few different questions. I'm going to put them together. Specifically, the mental health, the pandemic experience, is that unique to the US or the way Americans live? So I'm just put them all together, and then I'll again, we can go round robin and discuss it. How does the US market, the OUS market, compare in terms of, incident coverage, therapies offered, and so on? So like both from the mental health, the experience of mental health issues or challenges in the society and the care delivery of mental health. How do we compare with the rest of the world, if you have some thoughts? And then finally, is there what's happening on the policy side of the things? Do we need some research questions, or like what should we be doing at a more looking at it as both a national and maybe an international problem, like how do we look at it? So kind of let's take a zoom out a little bit here, and whoever wants to go first. Okay.
I'll speak to the global aspect of it because Amelia Virtual Care was a global company and we actually served over 50 countries. And what I can share from that is that the mental health crisis was experienced globally. The elevation that we saw in population experience of anxiety, depression, all these things went up uniformly almost throughout the globe. What was very different though was the business models, and because the reimbursement, the health system, right, the single payer system of the UK, the province by province system of Canada, and then in the US, the private insurer. So the ecosystem, the reimbursement is so different that really the go-to-market business models are very different. The leadership that the employers take in early adoption of technologies in healthcare. So that business landscape is very different. And then the second part of the question on a policy level, you know, I can say what I would like to see, right? Because what innovators really struggle with, you know, the tech, the ideas are plentiful. The challenges that entrepreneurs face is then when you get into the regulatory aspects, which Geeta is your expertise, but entrepreneurs navigating what needs to be regulated versus not. Do I, you know, and that's different in the US versus Europe versus other countries. So the regulatory piece is very obscure and very expensive. And then the patent piece as well, and then the reimbursement piece, which ties to some of these other things. So I think to the degree that government policy could make some of those burdens lighter for innovators and also for the people wanting to adopt the technologies. I remember when I worked in the diabetes space, the kind of approvals that we required from CMS for a simple diabetes solution to get deployed was a bit mind-boggling. So yes, policy, whatever policy can support the rollout of innovation would be super helpful.
So Prentice, I'll give you the last word on this one. Billy said a few words, right? Or I can pass back there. Anyway, since you have the mic, Prentice, why don't you talk about both any thoughts you have on U.S. versus other countries and globally, and then a policy focus on trying to solve this problem. And I think, Sunny, you mentioned both sides. I kind of want to hear a bit more about, there's both the provider side, the care provision side of the policy, and then there's also the preventive side of the policy. And maybe you can speak to both of those.
Yeah, so I'm not as familiar with the global situation in mental health, although the WHO did a study a few years ago that showed 1 out of 7 youth worldwide suffers from anxiety disorder. And I do agree, I think the pandemic had a significant impact, the isolation of our youth, and then in the U.S. particularly the impact of social media, because now you're isolated and all you're doing is watching social media where somebody appears to be having a great life, and then you're looking at the competition for you to move forward in your own life, and just all the various stressors. So it does seem to be significant in the U.S., but it's a global problem. And in fact, we have had a lot of interest from a lot of different countries on the Kintsugi tool, because the Kintsugi tool is content and language agnostic. We don't listen to that content. We actually look at only the spectral and prosodic elements of sound creation. And in terms of what happens then is we actually have a lot of other countries that call us. I do think the regulatory environment in the US is a hindrance, but it still seems like most innovation worldwide comes out of the United States. So despite the fact that it's one of the toughest regulatory environments, and actually I would really love to hear Geeta speak to this more, because she's very involved in the regulatory space actually. Even though we do have one of the most difficult regulatory environments, we still seem to have the greatest number of innovations in healthcare. I do think it's a policy issue on both the preventive and the treatment side, and that we need to have the correct alignment in terms of reimbursement and for our provider groups and for other groups of individuals too.
So Justina, I'll give it back to you. So recap again, any perspectives on, at a national level, policies or initiatives we should be thinking about and comparing or looking at other countries, either for inspiration or comparison?
I think what's interesting about domestic versus global is thinking about, at least from, let's say, the side of services or particular therapy, which I'm most familiar with, is the licensure requirements and the kind of credentialing required for licensed clinicians. And so, as an example, while Lyra provides services globally, we have essentially individual, when we provide therapy services, it's very individualized to country, versus where we've been able to really take our core coaching business, which has much less restrictions because of there isn't the same licensure and challenges, and been able to scale that from our U.S. business. So, and when we look at even in the U.S., a large part of our challenges when you're trying to scale, I would say both therapy and medication services, less so for medication, and here's the Prentice has more thoughts here, is ensuring that you have therapists who are licensed in the states that you wish to provide services. Right now, there is no holistic, essentially, agreement across all states where one provider can be licensed in every single state. There are some movement there. There's something called PsyPac for psychologists, where people can be licensed across 30 states. There's a counseling compact coming up soon, hopefully in the next year or so. But it actually is a huge barrier to really scaling the delivery of services. And a lot of providers like Lyra spend a lot of time and money really focusing on licensure. So from a policy perspective, if we were to have a unified licensure requirement and expectations for our clinicians to be able to provide services across all states, that would be a game changer. And when you think about globally, that is also a key restriction on really providing scaling services globally, and I think that would be a next step. But we could start with at least the U.S. To start.
Very important. Yeah, that sounds great. And then, so I think I've covered all the questions except a few more variations on the themes we talked about. I'll take a few minutes to talk about regulatory, since Prentice, you asked about it. Okay, so it's a big topic, but I'll summarize with a few thoughts. So first of all, when it comes to digital health, the FDA is still suffering from, let's say, twists and turns in the leadership. So they're still trying to figure it out on their own. Secondly, when it comes to AI, they are very quick to admit that they simply don't know how to regulate AI. And I will wrap this up into a general comment that I like to provide to all of our clients where we work with innovation is, if you're innovating and you're coming with something new that's never existed before, why do you think that the FDA would have expected it and come up with a regulatory framework ahead of time, right? You have to come into the agency knowing that they only have regulated what's been around historically. And if you're telling your innovators, your investors, this is the greatest thing since sliced bread, no one's ever done anything like it, no one else can do anything like this, and then you're going to go tell the agency, oh, nothing new here, same old, same old. You have to reconcile the two messages, right? You do need to come into your regulatory engagement with the FDA with a clear sense for what their charter is. Their charter is to safeguard public, they actually have two charters now that they drive. One is to safeguard public health and safety, which we've all talked about, and that's the thing we trip over. But the other, believe it or not, and they're really true to it, is to facilitate access to the latest medical technologies to the American public, okay? Which is why so many more innovations come out of the US. It's also one of the biggest markets, so a lot of global innovators come to the US market. So it's not entirely true that all the innovation initiates here, but it comes to market in the US. It often initiates, we work with countries literally around the world, pretty much 5 of the 6 continents, and all of them want to come to the US because A, it's a market, and currently, in this current environment, the single most, from a regulatory standpoint, the most friendly environment is, believe it or not, the FDA. compared to the rest of the world. The European medical device regulation is going through a transition period. It's completely backed up. It's a disastrous mess. Much of their brain trust came from the UK. With Brexit, they spun off. You cannot even get in the line to get approval for 15 months. Never mind actually get approval. So I'm foreseeing that for a period of about 10 years, from about 2018 through 2028, there will be no new medical technology innovations being accessed by the European markets. And it's not going to happen. So if you have an innovation, go to the US, get it out there. You can think about the European market later. The problem with this situation, however, is that this is a flip. For decades, the US was the hardest market. Everybody went to Europe first because that was perceived as the easier regulatory market. And the rest of the world, the bigger markets around the world, Japan, Korea, China's a different story, Brazil, Australia, some of these wealthier countries or countries with big markets would adopt would piggyback on European regulations. If you had a CE mark, you could go to these other countries and they would recognize it. There's no equivalence for the FDA. The FDA stands alone in its regulatory authority. It does things its own way, and it does things in unique ways that no other country does. Okay, so that creates a bit of a challenge to migrate a technology that's been approved in the US to other countries. Whereas if you had gone to Europe, you can much more easily migrate that to Asia. So this has caused a lot more concentration of innovation in the US. So that's what's been happening. In terms of strategies to get out there, obviously, start by putting yourself in the shoes of the regulator. Don't just go in and say, oh, I've got this great new technology. What do I have to do to get your approval, FDA? You go in by saying, we recognize that this technology needs to be safe and effective. It needs to be reliable. It needs to be cyber secure. It needs to be usable. These are all the factors that you get judged on. Go in with it and explain to the agency how you've met those and where you see the risks and how do you think that you can make those risks acceptable for the benefit it's going to provide. Now, let me say one last word on that before I wrap up. For the first time for the longest time, the FDA's rubric was, I'm going to look at this technology, this device, this closed little device in its own little silo, and see if it's as good as something else out there. Is this the best blood pressure measurement we can get? Is this comparing to the gold standard respiratory rate measurement? Is this EEG that's, from a $10 headband or $20 headband as good as, hundreds of thousands, tens of thousands anyway, in the hospital? And of course, the consumer technology always lost out because there's no way you can meet that. For the first time, I would say about 5 years ago, I started to see in the agency's guidance a focus on population health. So it's better to have less effective technology accessed by a larger range or larger population group than a more effective technology in isolation that's only accessible to one person or only accessible in the clinic. So leverage that, lean into that argument and explain how, yes, you may not be as good as that, EEG in the doctor's office or that stethoscope in the doctor's office, but you provide access to so many more people. So that's one. And then finally, I would say that argument, extend that a little bit to kind of the care cycle. Prentice talked about catching people earlier in the cycle, and the role of preventive care. And historically, that has not been the focus of the FDA, but it's definitely now in their focus. They're coming in, so come in with a holistic argument and talk about what is it that makes this technology worth making available to the American public, and keep in mind the FDA, our taxes pay for them to support our health and benefit, not necessarily the global market. The FDA tends to be a little insular about the global market. They do their own thing always, so that's kind of where we are. So, okay?
So I just have 3 quick things for the audience to just say before we wrap up. Thank you so much.
Sean, I was just going to give everybody a chance to do any final unsaid thoughts, then we'll wrap up.
Okay.
If you don't know. And, yeah. Any final thoughts, or it's done for the day? Why don't you tell us one optimistic thing you look forward to. Let's end on an up note here.
I was just going to go for a thank you, but in terms of an optimistic note, I think building off something that Prentice said, I think the more opportunity we have to really connect our mental health services to other types of supports, be it financial, housing, education, especially for the underserved populations, that's where I think the true opportunity lies. And so, I think we are working towards that, but I think that's really about having all the different systems we talked about today really come together in collaboration and very much as coordinated by the government. So that's my hope for the future, and I think we're all working to help make that happen.
Yeah, and I would just leave us with, this thought that, we all, a decade ago thought the predictor of success was IQ, and then we found out it was EQ. Well, you know what? It's next going to be mental health. Success is going to come to those who have good and strong mental health. So I hope that all of us here and globally can start to focus and obsess about our mental health in the same way that we obsess about how we look and what we eat and our grades and our wealth. We need to start making mental health our focus.
I didn't get a chance to mention this, but I have the opportunity to interact with a lot of different companies where people are creating solutions in mental health. And to me, the enthusiasm, the talent is just truly phenomenal. So I find it actually incredibly inspirational to work with groups and to see what people are trying to do to improve this very significant issue that's facing our society. I'm actually very enthused and optimistic about where things are going.
Okay, that's the final word.
All right, terrific. Before we resume networking, I just have three very quick things to do here. First of all, I wanted to present our speakers with these lovely MIT Moleskine notebooks. From the coop. We actually ordered them from the coop for the MIT guys, so thank you very much for coming. And we know that thank you very much for taking your time. And they're not meant to be, compensating you for your time, but a gesture of thank you for actually taking the time to be with us. And then I have two other quick announcements. The first one is, we're very adamant to make this a regular thing, so one event per month. And we're very excited. So you're going to see it on our social media, LinkedIn, in the next couple of days. We've got AI and genetics at Color Health with our very own Othman Al-Araki. It's going to be a fireside chat with him and Claire Bow. And then we've got a big conference type event during JP Morgan. It's called AI in Healthcare at JP Morgan. And this is meant to be an event for startups to come and exhibit because they don't have an opportunity to actually exhibit during JP Morgan. And our very own Jason is leading that event. Then we've got February, we've got an event on value-based care with payers. Afsana will be doing it. It's a virtual event, and it's going to be hosting payers, and it's going to be a very interesting way to really understand where we've gone with this value-based care journey. In March, we've done Diabetes Gone Wild. Again, Romel and Jason are co-leading that. And in April, we've got Evolving Standards of Care. So we still have two more events that we want to plan for May and June. And that's where I was going to leave it, is if you do want to volunteer for this track, specifically this track is focused on digital health. The club does a lot of other stuff, but we're very passionate about the consumerization of healthcare. And that's why we created this track, and we think that this virtual care is just going to continue, and it's going to continue to get better, and it's going to continue to innovate. So if you're interested in it, please talk to me, talk to Jason, talk to Romel, talk to Afsana, talk to Geetha. We're all active volunteers. We're always looking for more help. Thank you very much for coming out, and I hope to see you at the next one.
All right, networking.
You guys working awesome.
I sent a
Insanely confident.